Hello, everyone, and welcome to this Wisconsin Cheesemakers Association member webinar. My name is Rebecca Sweeney, and I serve as Senior Director of Programs and Policy for WCMA. Throughout the COVID-19 pandemic, WCMA has endeavored to bring you timely, actionable information to support your efforts to protect your valued employees and maintain uninterrupted dairy processing operations, fulfilling our essential mission to feed the world. Now, WCMA continues our work to inform and support you as we detail new vaccination and testing mandates issued by the U.S. Department of Labor's Occupational Safety and Health Administration, or OSHA, via an emergency temporary standard, also known as an ETS, specifically for employers of 100 or more people. Here's a look at what we're going to be covering in today's webinar. We're going to go over the basics of the ETS, what it requires of employers and employees, and we'll provide you with the status of legal challenges to the rule. We're going to share results of the latest WCMA Instant Data Survey, so you have an idea of how your peers in industry may be moving forward. And we're going to detail the resources available to you for ETS implementation. We're going to close today with a question and answer session, beginning with questions that were pre-submitted by members and getting to as many of the questions posed in the chat window as possible. We are fortunate today to be joined by two guest presenters. Allison True is Communications Program Manager for the COVID-19 Response and Recovery Team at the Wisconsin Department of Health Services, and she'll be sharing practical information, a how-to for employers interested in hosting a vaccination clinic. Kelly Rush, who works with the WisCon COVID consultation program at the Wisconsin State Laboratory of Hygiene at the University of Wisconsin, will present on what we know now about testing resources. Let's begin though with an overview of this new rule. On November 4th, OSHA officials issued an emergency temporary standard for private sector employers of 100 or more people, compelling them to establish policies by December 5th to require either COVID-19 vaccination or weekly testing and masking for their employees. The rule is expected to impact an estimated 84 million American workers. In the ETS published in the Federal Register the next day, November 5th, OSHA detailed the reasoning behind the rule, noting that COVID-19 has killed over 725,000 people in the United States. I believe that number is now up to 759,000 in less than 2 years, and infected millions more. OSHA has, quote, determined that many employees in the U.S. who are not fully vaccinated against COVID-19 face grave danger from exposure in the workplace, given transmissibility rates and the prevalence of infections in employee populations. That standard of grave danger is what OSHA believes gives them the authority to issue this ETS. The ETS takes full effect on January 4th, 2022, and it clearly states that a worker is considered fully vaccinated 2 weeks after the second dose of a Pfizer or Moderna vaccine, or 2 weeks after the single dose required for the Johnson & Johnson vaccine. This means that key dates for vaccination are quickly approaching. To be fully vaccinated with the Moderna shot by the deadline, an employee would need to receive their first dose on or before November 23rd, 2021. To be fully vaccinated with the Pfizer shot, which requires just 3 weeks between doses, they would need to be given their first dose on November 30th. The Johnson & Johnson shot would be required by December 21st. COVID-19 vaccines are widely available free of charge. However, beginning December 6th, under the ETS, large employers will be required to provide up to 4 hours of paid time off for an employee to be vaccinated, as well as paid time off should vaccination side effects prevent them from working. This paid sick leave can be drawn from existing employee benefits. It should be noted that mandatory vaccination policies must also include exceptions for individuals with medical contraindications, those for whom medical necessity will require a delay in vaccination, and those who are legally entitled to reasonable accommodations given a disability or a sincerely held religious belief. The ETS does provide another option to large employers to implement an alternative policy that allows their workforce to choose either COVID-19 vaccination, or if employees refuse to be vaccinated, to submit to weekly COVID-19 testing beginning January 4th, 2022, and masking on site beginning December 6th of this year. The ETS does not require employers to pay for testing. Employers may be required to pay for testing to comply with other laws or regulations, collective bargaining agreements, or other collectively negotiated agreements. Employers are also not required to pay for face masks under the ETS. However, employer coverage of testing costs and face masks is also not prohibited. Aside from the primary charge to develop, implement, and enforce a written mandatory COVID-19 vaccination policy or a vaccination and testing and masking policy, the ETS also requires large employers to do the following: determine the vaccination status of each employee, obtaining acceptable proof of vaccination from vaccinated employees, maintaining records of each employee's vaccination status, and maintaining a roster of each employee's vaccination status, ensuring these records are available for examination while the ETS remains in effect. Also, maintain records of all employee testing results while the ETS remains in effect. Employers must require employees to promptly provide notice when they receive a positive COVID-19 test or are diagnosed with COVID-19 and immediately remove them from the workplace and quarantine. Provide each employee with information in a language and at a literacy rate that the employee understands about the requirements of the ETS and workplace policies and procedures established to implement the ETS. And employers must report work-related COVID-19 fatalities to OSHA within 8 hours of learning of the death, and work-related COVID-19 inpatient hospitalizations within 24 hours of learning of the hospitalization. We want to take a moment to highlight acceptable proof of employee vaccination according to OSHA. These forms include a record from a healthcare clinic or pharmacy, a copy of a COVID-19 vaccination card, a copy of immunization records from a state, county, or tribal health organization's immunization information system, or a signed and dated attestation form from an employee when they cannot produce other proof required by the ETS. There are specifications to that attestation form, and if you need to go that route, it's important to look at those details. If an employer has already ascertained proof of vaccination for its employees, as we know many of you already have, and if you have retained those records, you will not need to reconfirm this data for fully vaccinated employees under the ETS. The ETS also does not require employers to monitor for or detect fraud in the proof of vaccination provided, but to ensure employees are aware of consequences associated with providing false information, such as criminal penalties, they need to be given information about what they'll face if they knowingly supply false statements or documentation. Companies that fail to comply with the ETS may be subject to fines of $13,653 per instance, depending on how frequently they violate the rules and whether violations are deemed intentional. Fines could also increase based on those factors. Enforcement of the rule is going to rely on employees reporting their concerns to OSHA rather than inspections. Jim Frederick, OSHA's acting chief, has stated that his agency will focus on job sites, quote, where workers need assistance to have a safe and healthy workplace, adding that, and again I quote, that typically comes through the form of a complaint. This tracks with known limitations for OSHA, as just 1,850 inspectors will be overseeing 130 million workers across 8 million job sites. Currently, 20 to 25% of all OSHA inspections take place in response to a whistleblower complaint. Now let's turn our attention to the current legal challenges to OSHA's ETS. As some of you may be aware, on November 6th, the United States Court of Appeals for the Fifth Circuit granted a stay of the emergency temporary standard, temporarily halting its implementation. The lawsuit was brought by state attorneys general and private employers that opposed the directive and claimed that OSHA either exceeded its authority or that the ETS overall is unconstitutional. In response, the Department of Labor's chief legal officer noted that, and again I quote, "The Occupational Safety and Health Act explicitly gives OSHA the authority to act quickly in an emergency where the agency finds that workers are subjected to a grave danger and a new standard is necessary to protect them," adding that the agency is, quote, "fully prepared to defend this standard in court." Both parties in the case have been ordered to submit next week, Monday and Tuesday, further briefing about the validity of the ETS, and WCMA will keep members informed of relevant developments. Similar cases have also been filed with at least 4 other federal appeals courts, so employers can expect to see more rulings in the days and weeks ahead. The bottom line is that the future of the ETS remains uncertain due to pending legal challenges, and it's unclear how long it will take for these lawsuits to be fully resolved. In the meantime, however, both human resources and legal experts have noted that employers may wish to continue to prepare for ETS implementation. In a meeting of WCMA's Workforce and Education Committee Tuesday of this week, we learned that most members that are covered in the ETS are preparing workplace policies related to the ETS. In an effort to help provide our membership with information about their peers' plans for implementation, WCMA launched an instant data survey poll late on Tuesday. 20 large employers representing a total workforce of over 33,000 employees responded within the 36-hour time frame of this survey. Now we can report to you the following results. 85% of those employers intend to move forward with a policy that allows their employees to choose either to be vaccinated against COVID-19 or to submit to a weekly COVID-19 test and masking in the workplace. The remaining 15% of employers shared that they have not yet made a decision as to whether their policy will require vaccination outright or offer employees the alternative to test. We've also learned that 70% of those large employers have not yet decided how to cover the costs of COVID-19 weekly testing. 25% have already decided to cover all costs associated with those testing protocols. And one company, so 5%, reports they will require their employees to cover the costs related to testing. Our thanks go to all those WCMA members who participated in that instant data survey. And whatever stage you may be at in researching the ETS or developing policies for implementation, we want you to be aware of resources that are now available to you. OSHA has posted a recorded webinar for large employers and their employees detailing the ETS. OSHA has also shared a fact sheet, a list of frequently asked questions and their answers, and 2 policy templates, one for those implementing mandatory vaccination and another for those offering the testing alternative to vaccination as well. I want to stress that these policies are designed so that an employer could, if desired, simply fill in blanks. To meet the education requirement of the ETS, OSHA is also recommending the use of an existing document, the Centers for Disease Control and Prevention's Key Things to Know About COVID-19 Vaccines. Much of that information is also available in languages other than English. These materials are available on wischeesemakers.org on our COVID-19 information page and will be distributed to all members in our next e-newsletter on Tuesday, November 16th. Now, to share information about another implementation strategy. It's my pleasure to welcome to our webinar, Allison True, who some may recognize from the Wisconsin Department of Health Services weekly stakeholder briefings. Allison, we really appreciate the communication and support you and your agency have provided to dairy processors in Wisconsin throughout this pandemic. And we are so thankful that you're joining us today to talk a little bit about employer-hosted vaccination clinics. Thanks for joining us.
Yeah, thank you. I'm going to get my screen sharing here. Thank you so much for having me. Really excited to be here and just to continue to spread the word about this valuable resource that we do have here for employers. I know I've had a colleague or two come on and talk about vaccine confidence and additional things, so thank you for having me back. So again, here to talk about a resource that we do have available to employers in Wisconsin, which is support holding an employer-located vaccination clinic. I think we can skip through this since we just heard a great deep dive on that from Rebecca. So DHS does offer support to Wisconsin employers of any size in holding an employer-located vaccination clinic. So how it will work is that usually DHS will provide the employer with a list of approved vaccinators or provide state resources when necessary and available. So a list of approved vaccinators could include pharmacies, healthcare providers, local tribal health departments, or even commercial vaccinators. And vaccine partners basically will provide both first, second, and booster doses. So I know that was a question, and it makes sense if you hold a clinic for first doses and someone wants to get their booster dose, they are able to do that, or vice versa. So really important too, if it's majority booster doses, that we're still encouraging first and second doses. So I will go through the process really quickly here and definitely stay around and be available for questions. If you're an employer that is looking to hold a vaccination clinic on site, the first thing that you should really do is talk with your local or tribal health department. I'll share some of these links in the chat once I get through. It's important that we're communicating with our local and tribal health departments because they kind of have the bird's eye view of what's happening in your community and may be able to either directly support you or connect you with a vaccinator that's available in your community. Now, in the event that that you are not able to connect with your local tribal health department or the support isn't there, you can request support, like I said, from DHS. And the way you're going to do that is by filling out a survey that's called the State COVID-19 Resource Matching Survey. This survey is found on our COVID-19 Partner Resources webpage. And again, I'll put all these links in the chat for you. So by filling out that survey, you'll be discussing your need, your location, a number of things. And then DHS will take all those details, look at the available vaccinators that we have, filter that, and provide the employer with a list of vaccinators to explore. Now, in the event that the vaccinator, you're not able to find a vaccinator, it's just not working out, that's when DHS will explore the option of providing state resources. So that would be leveraging the organization we use called AMI, who does a number of mobile and off-site clinics, or through our National Guard resources. When having in mind those National Guard resources or AMI resources, there is a time frame in requesting support from them. So although the first step will be likely a list that you get to, make phone calls and see what works best for you based on the parameters that you've set, do want to make sure you are aware of the request timeline for state resources, because in the event you do need state resources, I want to make sure that you're able to do it in the time frame that you need it. So requests can be accommodated, and that's, again, putting it through that link, the survey. Requests can be accommodated for up to 4 weeks out, but they must be submitted at a minimum or earliest by 8 a.m. the Monday of the week prior to your desired clinic date. So if you want it on a Thursday, you'll need to get it in by 8 a.m. the Monday before the previous week. And we also, think having in mind, you should be told whether or not you'll have support within 3 to 10 days. Now, it may take there may be a little bit of a process at first because you'll get the list and you'll try that out. Or it may be designated right away that you're a good candidate for that support right away. So there is a little bit of flexibility in the process, and want you to expect that and not think that just because you put in a request, you're right away going to be approved and get an answer. It may be, here's the list first, check it out, let us know. Or it may be, yep, I think you're a great candidate right away, we have a good match, etc. So there is kind of that leeway, flexibility in the process. And when you are looking to be matched with a vaccinator or have an on-site clinic, we do ask that if you have a limited number of unvaccinated employees, so 2, 3, 4, just a small handful of people, we really encourage you to organize or to talk with your employees about options that they have off-site. So just the amount of resources that it takes to get somebody on site for 1 or 2 people doesn't quite shake out. So that being said, we are here to support with that. If you have a handful of employees and don't know where to send them or don't know where to go, feel free to put in the survey and ask for that help. I'll also give a vaccinator email in the chat that you can email as well. So just thinking about what maybe would work best for your organization. I think I went already through this, but there is one resource that I want to point to here, and then there'll be a number of resources. Again, I know it's not super helpful to see it in a PowerPoint, so we'll put them in the chat, but we do have guidance for Wisconsin employers to better understand kind of the process, the implementation, the roles and responsibilities around holding an on-site clinic. A really great resource to review, especially if you kind of figure that out on your own with the Walgreens by you or another vaccinator, just to make sure you're feeling good about the process and what you're responsible for and what the vaccinator is responsible for. Either way, just, as a communications person, I can't resist a chance to talk about this. Either way, whether you're gonna, organize on site or send folks off site, it's really important that we keep talking about the COVID-19 vaccine and building the confidence among our employees. While this is a mandate situation, we still want people to feel comfortable and confident in their decision. And education is really key to this promotion. And most of all, addressing the misinformation or just creating a safe space for your staff to express their concerns, talk about their concerns, and get the answers that they need. I think it's really okay to understand that this is still a process for a lot of people, and it takes maybe often, frequently, more than one conversation with somebody who's not sure. And mandate or not, it's really good to have those conversations with people and to help your staff get to that point and feel really comfortable. And part of that, like I said, is creating that safe space and also creating a culture where getting the vaccine is part of being healthy. So we talk a lot about bringing in, when possible, a local doctor or a nurse or somebody that's trusted in your community to answer questions, to address common concerns. We at DHS are also willing to do that, happy always to join and talk with staff, but find that it does bring more impact when it's a local individual that your folks trust. Again, we have a number of resources. Want to wrap up here. I know time is tight. A number of resources on our DHS webpage and on the Wisconsin Economic Development Corporation's webpage to help, again, understand the process and also those support materials to help increase confidence in the vaccine. So there's a good list here. I can share all of those while we have the next presenter going here. And then just another reinforcement that really having employer located clinics is good for your employees, and it's really good for your business. Workplaces are familiar spaces for employees, and on-site vaccination clinics, it's comfortable, it's convenient, and really it's nice for folks to see people that they trust and see every day making a good decision. That's a big influencer in the sentiment around vaccine. So I think with that, I will pass it back to Rebecca, and no questions are held, I think, to the end, but I'm happy to stick around and answer any questions needed.
Thank you so much, Allison. We really appreciate your expertise and also just your diligence in continuing to communicate with industry throughout this pandemic. I want for anybody who might be watching a recorded version of this or who may not catch the links in the chat, I want you to know that those will all be added to wischeesemakers.org on our COVID information page. So that'll be readily available to you at any time. Now we've reached the portion of today's program in which we're going to be focusing on the incorporation of testing alternatives into COVID-19 workplace policies. And so we are very pleased to welcome Kelly Rush to our program. Members may recognize Kelly from our past webinars. She has served as a source of expertise and support for us throughout this pandemic. Or from on-site or virtual consultations that she's provided through her role on the Wisconsin COVID-19 consultation team with the Wisconsin State Laboratory of Hygiene. Kelly, we really appreciate you sharing. We know that we're still learning more about testing resources and alternatives, and we appreciate you sharing what you know about that now.
Absolutely. Give me a moment. I'll get the screen shared. So as Rebecca mentioned, my name is Kelly Rush. I'm with the Wisconsin State Laboratory of Hygiene. I know I've probably spoken to some of you that are on this call about different testing strategies. I want you to know that we've heard your comments, questions, and concerns, and together the State Lab of Hygiene, in partnership with Department of Health Services, is working on creating a antigen testing guidance document. So we've been working on that for over a month now. We're hoping that it'll get released soon. So I would keep your eyes peeled, and as soon as we have the information and that becomes a live resource, I will make sure that that gets shared with you all as well. There are some different places that you can go to utilize different tools or resources when trying to determine if it is a smart move to adopt a testing strategy for your own workplace. One of those is the FDA approved antigen testing guidance list, and this is on the FDA's website. I'll make sure to drop these links in the chat after this. But this is a place you can go to find out what available tests there are for antigen testing and to determine if it's feasible or affordable for your workplace. You can look into different options that are offered by clicking through the links that are available on the FDA's webpage as well. One of the ones that I'll just use as an example is the Abbott Bix Now has been a really popular one with other groups we've worked with. They have a really great website that you can go on to find more information. If you are a business and you're looking about how affordable it is and what that could look like, you can also go to their website, contact them, and they can send you more information. The majority of the websites for antigen testing do have really easy interfaces where you can go and watch demos or figure out what it would look like to implement in your own workplace. So again, not an endorsement of this one. It's just one that happens to be really popular amongst the groups that we work with. But again, feel free to do your own research, click through that FDA list, go to some of the websites of maybe some of the tests that you've heard of previously and see maybe what would be the most feasible to implement or straightforward, or what that expense could look like for your own business. Additionally, there's a really wonderful guidance document that was put out by the Rockefeller Foundation in partnership with Duke's School for Public Health Policy. And this is 3 steps to smart COVID testing, a guide for employers. And so I'll also add in that link. It is a little bit of a lengthier document, so it will take time to work through, but it talks about the importance of doing a risk assessment, determining what percentage or portion of your employees might need to have that testing strategy implemented, when it might be good if there's a higher community spread to implement this testing strategy. But really, overall, it's a really wonderful resource that you can use when making determinations if testing in the workplace is feasible or considering outside community options as well. Additionally, there are some requirements that come along if you decide to do COVID testing in the workplace. There was a memo that was put out back in February by Dr. Ryan Westergaard, who is the Chief Medical Officer for the state and a communicable disease epidemiologist, talking about the requirements that come when you decide to do antigen testing in the workplace and the reporting requirement that comes along with it. So there are some additional steps you as an employer would need to take if you do decide to do that testing in the workplace. So you would want to refer back to this memo is a really great one. There was also a health alert on antigen testing that was put out. This one is a little bit older, back in September of 2020, but both have really relevant information and resources if you're trying to, again, determine what the strategy is going to be for you in your workplace. Again, once the DHS is able to put out their own antigen testing guidance, we will share that with you. Again, it's coming down the pipeline. We just don't have a date when that's going to be released yet. And additionally, when making a determination if it is smart or not to test in the workplace, you can also look into what other testing sites are around your location or around your business in the city that it resides in. So one of the smart steps or proactive steps that you could do as an employer is start calling local pharmacies or local areas to see where your employees could be referred to go for testing, whether it's like a CVS or a Walgreens, maybe it's your local or tribal health department. You could also try reaching out to your local or tribal health department to ask if they have a more updated list. DHS also has a resource where you could see where testing is in specific areas. So no, there are a lot of resources out there to help you, one, make the determination if you should test in the workplace, and then two, otherwise referring your employees to outside resources. But if anyone has any questions, feel free to reach out to us at the Wisconsin State Laboratory of Hygiene, our COVID consultation team. We're happy to point you in the right direction. So do you have questions if you're reviewing any of those guidance documents that have come out, or have specific questions about antigen testing?
Thank you so much, Kelly. And I know we've got a number of questions coming up about testing antigen versus PCR, OTC, on-site versus remote testing. So we're going to get into that in just a little bit here. In fact, we're going to transition right now into our question and answer portion of the program. And we want folks to know that we're going to begin first with questions that were pre-submitted by members so that they could be posed anonymously. And then we'll try to get into any questions in the chat if time allows. I'd encourage you to send those questions directly to me as opposed to everyone on the webinar if you'd prefer to submit them privately. So here's our first question. We have more than 100 employees across 3 different job sites. Does this rule still apply to us? And I'm hoping that Kelly might be able to weigh in on this question.
Yeah, thanks so much. So how it works is that all individuals employed by the employer, regardless of location, are counted. And that is without regard to whether they work at one or more locations, if they're out of their home or elsewhere. In addition, there is no distinction made between part-time employees and full-time employees, and each is counted as a single employee for the purpose of that 100 threshold. And so that is kind of what you're looking for. So if you are a facility that has multiple locations, maybe you have a factory in a storefront in a different area, maybe you have employees that are working from home if they're in more administrative positions or in sales, things like that. It is the total number of individuals employed corporate-wide, regardless of where the locations are. It could even be outside of the state. They would still be counted towards that total number.
So the short answer here is yes. If you've got 2 in one location and 90 in another location and 30 in another location, you're above that 100 threshold. This is firm-wide, company net-wide, not location-based at all. Thanks, Kelly. Our next question, for reporting purposes, how are we to determine whether a COVID infection was workplace related? And this is, I think that this will be challenging, right? Because we're aware of spread in workplaces, but also in the community and also via kids coming home from school. And so how does one navigate that? Kelly, can I call on you again for this one?
Yeah, of course. So what we say is we want you to refer to your local or tribal public health department. They will help and assist in determining if it's potentially work-related or community-based. They may call on your help as a business to see if any other employees are complaining or have tested positive in a 2-week period to see if there's any cases that could be linked. But as you mentioned, it is really hard right now with that increase in community spread. But ultimately, usually it's the public or tribal health department that will make the determination if it's work related or not. It's not usually up to the business to determine if it is work related, unless there's a really clear link that like maybe there's a major outbreak, then it could be more closely understood that it could be related. But traditionally, that would fall back on that local or tribal health department to help make that determination.
We also want to make folks aware that OSHA has a fact sheet out on how to make this determination. It's complicated, but they do have a fact sheet that you could refer to if you have questions about, and we're going to post that to whizcheesemakers.org today. Our next question, I think this is quite clearly going to go to Allison, is and I think that you kind of covered it, but just for the purposes of underlining this fact, do vaccination clinics offer booster shots as well as first and second doses?
Yeah, and the answer is yes. It should be, it shouldn't matter where they are in their dose as long as they're able to be found and collaborate what dose they should be getting that's appropriate. So yes, always want to take advantage whenever we have something on site that people in all stages of their vaccination journey have access to the vaccination they need.
Allison, I have a follow-up from the chat here on this question as well, and I'm not sure whether you'll know off the top of your head, but this person has a question about whether vaccination clinics typically offer different kinds of vaccinations, like Moderna, Pfizer, and J&J, or they're just offering one per site?
Yeah, that really depends on the site. So there are times, and that likely, I think, just given the new eligibility among children, that there'll be specifications, of course, whether just want to do adults or would you like whole families to be able to come in, and in that case would need the pediatric Pfizer as well. So that's really a conversation that you would have with the vaccinator, whether it be a state resource or just an approved vaccinator, and see what they have available and what they're willing to do. But there are clinics that have done all three and some that stick with one.
Thank you for that. I'm going to field this next one because there's a really clear answer from OSHA on it as well. The question from a member is, are there specific types of face masks required for employees who opt to test weekly instead of vaccination? So OSHA said here in their FAQs that a face covering means a covering that completely covers one's nose and mouth, is made with 2 or more layers of a breathable fabric that's tightly woven, and is secured to the head with ties, ear loops, or elastic bands that go behind the head. So if gaiters are worn, they should have 2 layers of fabric and be folded to make 2 layers, fit snugly over the nose, mouth, and chin with no large gaps on the outside of the face, and is a solid piece of material without slits, exhalation valves, visible holes, punctures, or other openings. Face coverings may be manufactured or homemade, and they can incorporate a variety of designs, structures, and materials. And they also noted that, of course, face coverings do provide variable levels of protection based on what they're made out of and how they're constructed. But generally speaking, we're talking about a face covering that covers your nose and mouth, has 2 layers of breathable fabric, and is secured behind your head. So there's a lot of flexibility within what a face mask is according to OSHA's ETS. I do want to just note as well, since we're on the topic of face masks, a couple of exceptions for unvaccinated workers wearing masks. OSHA states that you must wear a mask if you're not fully vaccinated when indoors or occupying a vehicle with another person for work purposes, except when an employee is alone in a room with floor to ceiling walls and a closed door, or for a limited time while the employee is eating or drinking at the workplace, or for identification purposes in compliance with safety and security requirements. So there are those extremely limited exceptions. Our next question, can we use an over-the-counter testing kit from a pharmacy to meet the rule requirements? Perhaps this is a question best posed to Kelly. What do you think? Can I get that Walgreens test and call it done?
Yeah, so it really depends. If it is approved on the FDA's antigen testing list, that is definitely something you can use then for that over-the-counter test. I know, again, just as an example, Abbott's Bix Bionex Now test that I used as the example, that is one that's frequently sold in Walgreens or CVS. So you could absolutely utilize those in the workplace. You would just have to have your employees, if you're having them do it at home, like take a picture of that result so that they can share it, or have them do it in the workplace so that you can verify what that result is.
And I do believe that that ETS is issued, or that the ETS FAQ issued even more insight on this topic. So if you're using an OTC antigen test, it cannot be self-administered and self-read unless it is observed by the employer or an authorized proctor. So the antigen tests indicate that current presence of infection, and OSHA recognizes them as effective tests because they're FDA approved. But OSHA included that requirement to make sure that there's independent confirmation of the test result. So it is really important that there's that integrity of the test result. And so there isn't a third party or a second party involved in that. It can't just be me taking the test in my home alone before I come into work. Another question here, do office and sales staff working remotely have to be vaccinated or tested too?
So
I suppose this depends, right?
yeah, it definitely depends. So the way that it kind of plays out is the ETS provides a certain limited exemption to those vaccine or testing rules. And that's specifically that the rule does not apply to employees who work from home 100% of the time, and those who do not report to the workplace when other individuals are present, or they work exclusively outdoors. So, you know, that's kind of the caveat there, is if you aren't coming to the workplace 100% from home, working remotely, you don't have to follow that piece. But the second you get called into the office for a meeting, or you're coming in, you would have to provide your vaccination status then, or a negative COVID test prior to returning to the building. Additionally, if your workplace is one that they themselves have taken the stance that vaccination is mandatory, that would be one of those caveats where obviously you would have someone be vaccinated then, kind of regardless of that stance. But otherwise, if they're working remotely, they're not coming into the building for any reason, they're not interacting with other employees in person, they would not have to follow the ETS.
Yeah, so as a practical example, if you have a salesperson that's out on the road for 2 weeks, but nowhere close to your facility and not coming in, they technically wouldn't need to test at that time. But within 7 days prior to returning to the workplace, they would need to get that test. So the answer to that question is it depends for sure. How long do we have to keep records on vaccination and testing? OSHA, again, made this pretty clear, so I want to make sure that I just go ahead and tackle this. OSHA anticipates that the ETS is going to be in effect for 6 months from the date of publication in the Federal Register. That would take us to May 6, 2022. And OSHA has also noted that it's going to continue to, of course, monitor what's going on with the pandemic and trends in COVID-19 infections and deaths. And they will update the ETS if and as appropriate. So we know now that they're expecting it to be in effect for 6 months. Could it be extended? Possibly. And we'll keep members informed on that as well. Just want to close today by thanking our guest presenters and all of you for your interest in today's program and for your very important work to protect your workforce and maintain dairy processing operations. I also want to thank my lovely colleague, Sarah Schmidt, who's our business and membership manager and serves behind the scenes so often to make our program successful. Please know that all of us at Wisconsin Cheesemakers Association are here to help and support you, and we invite you to bring us your questions, concerns, and ideas at any time. Thanks so much for joining us today. Have a great afternoon.